My fellow Sierra Leoneans, on this second day of March 2024, I bring una another episode of Le We Fix Sierra Leone. This episode of Le We Fix Salone go deal with a broken health system and how a group of Sierra Leoneans, with help of other members, come together for build and help for fix Salone. As we know, Sierra Leone na a broken country. Sierra Leone na a corrupt nation. Sierra Leone get political instability, economic uncertainty, and all kinds of social ills and issues. We youths that die of kush. Unemployment is at the highest level. But yet, we Sierra Leoneans are resilient people. And if we come together for Fix Salone, we know we'll go able to do so because we get the tenacity and the fortitude for change the trajectory of our country. In this episode of Le We Fix Salone, I can showcase a health initiative and also community service from across the country for sure. If we come together and work together, we go fix Salone. We know say we health system is a broken system. Let me repeat it. We health system is a broken system. And again, for take we all collectively for come together for build we health system them so we go take care of the people of Sierra Leone. This episode showcase a group of Sierra Leoneans them from the United States within the medical field and we decide that they for run a medical mission in Sierra Leone to help the people of Sierra Leone. So while this mission I will consider a drop in the ocean, it symbolizes one way we go fix Salone.
Dr. Sharif and team that they can do for we now we country as a whole. Then call me, then give me the message, and myself, I really appreciate the turn up of the people in this community. I really appreciate una. So at the beg una, how we then tell una for let una take the medicine, let una go take her according to. If you not get understanding for take her, let you go ask, then go teach you well how you for take the medicine. We there today, we there tomorrow. So any kind sick way person gets, we know say diabetes day. Diabetes is sickness where they kill. Some people and they get diabetes but they don't know say they get them. Some people and they get hypertension, they don't know say they get hypertension because they're not they do follow up, they're not they go for checkup. So at the break, anybody where you they know say where you cannot say you cannot you status no say you get diabetes or hypertension. If they give you the medication, at the pray, at the beg una let we go take care. So once more I want to tell healthcare them that say they're really welcome. We appreciate them very much in our community.
So today we see everybody. We go sound winner. We go try find what's wrong with now. We give una medicine them, and we go make sure say if nothing where you for follow doctor, we go make that arrangement. All not free. We not ask anybody for pay penny for what we do. So once again, Madam Chair Lady, I want to introduce the guests to you, present them to you. This now, family them. When a brother then doctor and then nurse them, and come for help with people then are here, yeah? So if you get small work for say, we can appreciate that.
Good morning, everybody.
Good morning, ma.
First of all, I want to say, Papa God, thank you when it can possible for we all able for the night today. Because it's not only grace, we are able for the night. And I want to tell Healthcare Salon, thank you. For where God did not take them, carry them going to the aspire. The members say they get country where they come out. And the members say them people in a salon where they struggle. When God go give them, they not hold on to themselves. They not be selfish. The members say, let them come back to their country and can help people them. Let God bless them.
Amen.
Let God reward them for waiting.
Amen.
Let God make the medical treatments when they can give. Let God bless the medical day. Anybody will partake of family.
Amen. Amen.
And I want to tell me, family they come out from different villages. We Buesong, we are people that we accommodative. We are people that we get love for people. Because it's not a love, this benefit we come, we not extend and to other different villages. But we talk and feel say we all are one people. We all look for help. We all ask God for let God give us sound help. So if we get an opportunity, then I make we call all the different villages so let us can be benefits to that. So do I they ask we all as we they come, whether they can't treat we, whatever medicine where they give we where we go, let we take them to how they get for direct you. I believe so when you take them to the way where they tell you for take them, you go get to healing. So I want to tell everybody thank you.
Also, this mission by itself bring another side of we as Sierra Leoneans, which is community service way. Now one way that way we go help give back for fix Sierra Leone. You know, as I can say, now ask waiting Sierra Leone go do for you, but ask waiting you go do for Sierra Leone. Because it is only when we do for Sierra Leone will be better and we go able for fix Salon. So Dr. Sharif, we now a member of Hope for Youth Sierra Leone, I would highlight him as the face of this organization, but you will see the team we go with this medical mission to Sierra Leone. And you will listen to them and to see the vision of how we will help fix with broken system in Sierra Leone. But as part of the medical mission and decide for partner with Hope for Youth Sierra Leone, the organization we are fan and we a lot of people they help me build, follow we help fix Sierra Leone. The mission started in Moyamba on February 20 and it ended in Naburetan in Freetown on February 24. The outcomes of this mission is what is important to me, and there are very positive things about it and things that make me feel so sad. But let's look at the positive things. The mission by itself, then treat in Moyamba, in 3 days, over 1,500 people will get basic evaluation and treatment. And then in the Boeretown area, in Freetown, they treat close to 1,000 people. This is on their own time and dime. Nobody not give them money. They collect themselves from the United States. Doctors, nurse practitioners, nurses, volunteers, they organize themselves, ship medication to Sierra Leone, and go treat Sierra Leoneans them for free. This is fixing Sierra Leone. You see, them people they're not the only doctors them, nurse practitioners them, and no system within the United States, the United Kingdom, the Europe, the Australia, the Canada. But they choose to go help for Fix Sierra Leone. My fellow Sierra Leoneans, we cannot wait on the government for fix we don't get opportunities for help fix ourselves. Because we get people who dedicate their time for help fix Sierra Leoneans. And we get to give them credit for the work we didn't do, because it's benefiting Sierra Leoneans in general and improving our health system one person at a time. But I just talk about the number of people that we didn't treat. But on the downside, on the last day of each of the treatments, na Moyamba and na Bure Town, hundreds of people away waking up morning day for can get treatment did not get treatment because the mission ended. And as the news, when they go around, people then travel from far areas from Moyamba, different chiefdoms, for can get this basic examination we don't know when they get. But because there was a time factor, a lot of people were disappointed, then go back home without receiving any treatment or get medications. The same happened at Bure Town on February 24th. That once word gets out from Kent, from Campbell Town, from Koso Town, from Calabar Town, from York, all over Toke, people are all converge for go get medical treatment. But the mission may get for end. And they turn away more people than the people they wouldn't see. So I appeal to those who are in the medical field in America, in Canada, in the United Kingdom, in Europe, all over the world, with people there, they suffer and they die from hypertension, from diabetes, from typhoid, malaria. These are things that are preventable if they are treated early, if they are diagnosed, and people know what to do in terms of good eating habits and social lifestyle. My fellow Sierra Leoneans, who could fix alone through health education. When I'm not going to do a medical mission, if we not get them, it will be helpful. But I could tell you that of the 2,500 people that we didn't see, significant number hypertensive patients. The stress of Sierra Leone, they kill with people. And we not get the basic treatment. We not get the basic preventive treatment and health care. For go check people their blood pressure and tell them, say, you are hypertensive. So that they appeal to them for fix Sierra Leone. That was the downside to it all, but it was a beautiful, beautiful medical mission. And I want to thank the medical mission. As when I see their names are all listed for an amazing work to give back to Sierra Leone. Now let's look on the other side of community service and what it means to help fix Sierra Leone. You know, Hope for Youth partner with the medical mission and to bring the youths and Afford School for Girls in Moyamba, where they may not go clean the hospital, to support the medical mission. Our youths and people do not know what's in our community service and the impact of that. But I could see the light that between Moyamba and Freetown, Hope for Youths, Afford School for Girls, Hope for Youths, Moyamba Chapter, Hope for Youths, Juba, Hope for Youths, Kuto Road, Hope for Youths, Duazak, Hope for Youths, Regent, Hope for Youths, Kisii, Hope for Youth Wellington, and Hope for Youth Western Area, they come together. They gave 80 manpower, individuals across the mission. And each of them people and they provide an average of 8 hours free to the medical mission to make it successful. Folks, that's over 640 hours that youths them and young adults and Sierra Leone where they say useless, where they say not go help do anything in Sierra Leone. They woke up in the morning at 5 o'clock for go support a medical mission with no strings attached. That's beautiful. They volunteer their time for their country. You know, they ask what in Salone don't do for you. You ask, what you go do for Salone? And for 5 days, we see the beauty of giving back to your country. Folks, we could fix Sierra Leone. It's all about hope, leadership, and vision. And the beauty of it all, for once, the youths that will participate, they see the meaning of helping your country, and they see the meaning of a role model. For the first time, youths in their 20s, in their 30s, high school picking and Moyamba, Afford School, they see role models. You see, in Sierra Leone, the role models are politicians, members of parliament, people that will get money through illegal ways. But for the first time, young ladies in Afford School, they see female doctors from America. And 1 or 2 of the doctors then go Afford School, which was so impressive as role models. They see nurse practitioners as role models. They see nurses, people who look like them, where they talk like them, we come on at the same districts. They felt so empowered. Where they work with the nurses alongside them, at triage, they work at the pharmacy, they work at crowd control, they escort elderly parents. They felt the reward of being a Sierra Leonean, of what it means to give back to your country. For the first time, they experience it. Folks, it can be done. Let we pull ourselves together, let us not rely on government. Government don't fail Sierra Leone for 63 years. Government will fail Sierra Leone for another 63 years. But we, the people, we, the Sierra Leoneans, we, the professionals, we should be the role model. You see, Mami Kos may not begin take over Sierra Leone. Now that the Pekin may not begin see. Mami Kos role models, Mami Kos politics, Mami Kos everything. To the point it don't normalize. When we small, when we hear Mami cause, we say a bad word. We cannot even think of it, let alone say it. But now it's normalized. But this medical mission by this amazing team we come out United States don't put a dent, a legacy, and an indelible legacy on the minds of the 80 youths them will go participate. To say the vision for what we want is not politics. The vision for who we should become should not be politicians. But the vision for who we are as Sierra Leoneans is service to our nation, to fix a broken system, to fix a broken health system. And we could do it one youth at a time, one village at a time, one town at a time, one chiefdom at a time, one district at a time, one region at a time. And collectively, we could build the new America of Africa and Sierra Leone.
Hi everyone, I'm Priscilla Alessiamba, a member of Hope for Youth Sierra Leone Afro Ladies Club. Well, I'm a commercial student, but because of what the medical team did, I'm so impressed and I've made up my mind to do nursing.
Good afternoon everyone, I'm Tima Lamboy. I'm a member of Hope for Youth Afro Ladies Club. I now know that I should not ask what Sierra Leone have done for me, but what I've done for Sierra Leone.
My name is Noah Panabom. I'm a member of Hope for Youth for Girls. I gave support to the medical team that came, and I must say I learned to give to people whatever you have. Thank you. Hi everyone, my name is Ishmael Tuemara. I was really impressed by the medical team that came in Moyamba district, leaving their people out there to help others. It teaches me a lot that you should always help others before seeing to yourself.
I'm Joyce Keru, a member of Hope for Youth Afro Ladies Club. I gave support to the medical team. This inspires me more to help those who need help. Thank you.
Hi everyone, my name is Ishmael Tuemara. I was really impressed by the medical team that came in Moyamba district, leaving their people out there to help others. It teaches me a lot that you should always help others before seeing to yourself.
Good afternoon everyone. I am Sarah Duba, a member of Hope for Youth Sierra Leone Afro Ladies Club. Due to the way they were carrying their activities, I now know that there are people that have Sierra Leone at heart, and my mentality have changed to help Sierra Leone at all costs.
That would be the envy of the world. And this medical mission did exactly that. From one youth to a region, they did. And so I call upon all Sierra Leoneans. Let us wake up and let us fix with Sierra Leone. There are many ways to fix Sierra Leone: the health system, the education system, our tourism, our infrastructure. Kush, kush, kush. Say no to kush. They kill the youths of Sierra Leone. High blood pressure, hypertension, diabetes, typhoid malaria. When other countries of Africa are eliminating and extinguishing malaria and wipe out malaria in other countries, we are the hub of malaria. We are so broken that even when we politicians are sick, they have to find an excuse to go to another country to avoid the broken system they created. Sierra Leoneans, let us fix Sierra Leone. This episode of Level Fix Salon show how volunteerism and a health mission and community service could make a difference. God bless you all, and God bless our beautiful Mama Salon.
Welcoming all here today with our hearts full of joy. Welcoming all here today with peace and love. So we welcome you. Welcome, Dr. Sherry. We welcome you, Dr. Sherry. So we welcome you. Welcome, Dr. Sherry. We welcome you, Dr. Sherry.
Thank you. Thank you, ladies.
Can we all listen? Now let us all be attentive, okay? We have some guests on our list, and they are here. I believe this Campbell has been talking about free health services that we'll be getting. Is that not so? Okay, these are part of the group that have come to give us free health, that we will not pay for. It's a service that will be free for anybody who goes to the hospital. And they are part of Hope for Youth, eh?
Yes.
Okay, so now we all know Miss Campbell is in charge. So she will tell us more about the group. Miss Campbell.
Yes. Good morning, school.
Good morning.